Hi guys, this is John Adamson, the Rehab Documentation Guru. And today what we're going to do is we're going to talk about mainly patients that are in the midst of a new medical problem. So the patient that you're working with that develops a new UTI, the patient that you're working with that develops a new pneumonia. In other words, an acute exacerbation of something that now is causing a major barrier to your progress on your functional goals. How do you address those things? And how do you prove that your skill as a therapist is necessary, sometimes even in the midst of some of these disease processes? Let's face it, some of you are in settings where you are asked to see patients during times of illness, and you're wondering, what am I going to do with this patient right now because they're really sick and they were making good progress, but now they're sick and I need to just let them recover. Can't we just let them recover? And there are going to be times where you need to just let them recover, that it's not going to be safe or effective for you as a therapist to treat them in the midst of the problem. But before we get into that, we need to discuss some things that not everybody that's on this YouTube channel may be privy to, that those who have attended my courses are privy to, and that's the distinction between functional deficits and underlying impairments. A functional deficit is something that we as therapists address. They're things that the patient has to do to live life. For example, they do ADLs, they do mobility tasks, they communicate, they do swallow function. These would be the general functional categories that we as PTs, OTs, and speech therapists would recognize. We need to distinguish that, though, from underlying impairments. Underlying impairments are the things that we learn to measure in school or maybe at continuing education courses that cause the functional deficits to begin with. Things like range of motion, strength, balance, coordination, cognition, etc. We learn to measure those things, and by measuring those things and knowing how to measure those things, we in part demonstrate our skill and knowledge as a therapist. So what I want to do now, after I've reviewed that briefly, is talk about a medical scenario. And the medical scenario I've chosen is a 86-year-old patient who develops the flu, and as a result of the flu has a fever. And so we want to know, how can that fever impact her underlying impairments, therefore impacting the functional deficits the patient has. And that's really the key. That's the nitty-gritty the therapist has to get down to. And so on the next slide, we're going to look at some more details about that fever. One of the things we know about fever is that it can cause a lot of different symptoms. Some of those symptoms are subjective, how the patient's feeling. Some of them are objective, but even the subjective ones have impact on the patient's underlying impairments and functionality. So for example, one of the things that a fever can cause is something as simple as a loss of appetite. Now what we want to do, though, in that case is think about, how is that loss of appetite going to impact that patient? If they're working on dysphagia treatment, well, it could impact their willingness to swallow. They're not going to be as willing to maybe work on the strategies that the speech therapist is employing to improve that swallow. But here's another thing. It could have overall impact in just everything in the patient's life, because maybe they're not consuming enough calories to give them the energy they need for the sustained activity that we're asking them for. Patients that are having fever can be subject to dehydration. So that could be impacting their cognition. Patients that are dehydrated also have strength deficits and endurance deficits. Think about how we can measure that and quantify that, though. Things like manual muscle testing might not pick up subtle differences in strength, but functional strength tests might, like the 30-second chair rise test. Endurance, and you've heard me talk about endurance perhaps in the past, where it means nothing by itself until we use measures of cardiopulmonary parameters, which I'm going to get into more in a minute. Concentration, I don't know about you, but when I have a fever, I don't concentrate well. I don't want to think about things. And so that's going to impact their ability to sustain activities and learn new activities. Hyperalgesia, which just literally means increased sensitivity to pain. If you're working with a patient who has pain limiting function, those pain numbers might actually go up in the midst of the fever, and we want to quantify that. How is that impacting their functionality? Lethargy, sleepiness, it could obviously impact all areas. Muscle soreness and achiness. Think about the last time you had a flu and that general achiness you feel and your unwillingness to use your muscles. That could be a big impact we can measure, we could quantify. Headache and irritability. Now, one thing I skipped over was increased heart rate and respiratory rate. And think about that. I forget what the number is, but there is some literature on how much of a general heart rate increase or how much respiratory rate increase you'll get for each degree of temperature rise in your body. And so if somebody becomes bradycardic or tachypnic or both because of, I'm sorry, tachycardic or tachypnic because of a fever, then that could have huge impact on them, because if the patient already has a very low cardiopulmonary performance that they are able to utilize in the functional activity, and now because of their fever, they're getting even less of a window of safe cardiopulmonary performance, that could have a huge impact. And we can measure that, we can quantify it, and that part of that quantification and analyzing that problem is a demonstration of our skill. So the bottom line of what I'm getting at here is that any disease, and this could be like a chronic disease too, but we're mainly focusing on new illnesses, is going to cause some kind of underlying impairment. And especially if you're noticing that the patient's functional performance decreases while they're in the midst of an acute illness, there are underlying impairments. It's your responsibility as a therapist to determine them and measure them. And this is one thing I really get on therapists strongly about, is we don't measure like we should. And you went to a place called school, you learned a lot of really neat techniques on measurement. You are responsible for getting the measurements on these things, objectifying them, finding out the impact on the functional deficits. And then during this time that the patient's facing this acute illness, if we're going to keep them on caseload, we have to think about 4 aspects of treatment and how can we impact the patient positively in these areas during that new onset acute illness. One thing could be that you shift an improvement based care plan where you're working on improving strength, balance, coordination, range of motion, etc., and you shift it to a maintenance program. So you're just trying to at least keep them where they're at during the midst of that acute illness to make sure they don't lose any ground. Since the Glenda-Jimmo decision in 2013, that is recognized, at least by Medicare, as a viable treatment option. The question in the maintenance perspective, though, becomes, are we really necessary as PTs, OTs, as speech therapists to maintain them in the midst of this acute illness? The question might be, can we even improve any underlying impairments while they're sick? So if they're in the midst of having a flu with fever, is it reasonable to expect that they're going to improve their cardiopulmonary performance or their communication capabilities? And I would probably say no. So what we probably will be doing at the best is maintaining their underlying impairments, not improving them in the midst of an acute illness. The next thing we want to look at is, can we show that the patient can learn compensations for their acute illness? Suppose this patient maintained their cognitive status just fine while they're having a fever. Could we show them ways to compensate for their weakness, their muscle aching, their higher or their lower cardiopulmonary performance during the illness? That would be a compensation technique to help them at least keep functioning during that time. That might be a skill. Now, if this patient's cognition was impacted, then the question becomes, can we safely and effectively impart compensation techniques to this patient in the midst of that? And then finally, one last approach that we can utilize to treat patients in the midst of an acute illness is environmental adaptations. And this is mostly going to fall under the category of caregiver training. Can we train a caregiver to take care of the patient in the midst of this fever that's causing all these new underlying impairments, to make sure that the caregiver is still safe and effective in helping the patient maintain some level of functionality. And that's how I would break it down in the midst of a new illness that creeps up that basically presents a barrier to our progress. Anyway, I hope you found this helpful. Again, my name is John Adamson, the Rehab Documentation Guru, and please like and subscribe. And if you find yourself willing and able, I would greatly appreciate any donations to my GoFundMe page. This helps me keep on doing this content, and as I look for other avenues to help me support my family. Many of you know I have 9 children, and I'm in the process of adopting 3 more, so we're going to have an even dozen, and so any funding is greatly appreciated. Anyway, you guys take care. Thanks so much. Feel free to leave a comment and any suggestions for future videos. Bye-bye.